We hear a lot about the AI revolution in medicine, right? But here's the thing, it's not enough to just be wowed by the tech. We have to be smart, critical readers of the research behind it. And that's exactly what we're going to do today. We're going to take apart a really interesting new study, think of it as our case study, to build up our skills for spotting what's real and what's just hype. All right, so here's the game plan. First, we'll get into the medical puzzle they were trying to solve. Then we'll look at how they set up this awesome head-to-head comparison. I'm calling it the Great Methods Bake-Off. We'll see who won, but more importantly, we're going to dig into the details. And finally, I'll give you a toolkit you can use for pretty much any paper you read. Okay, so any good research paper starts with a really compelling problem. Let's dig into the challenge these researchers were facing. So picture this. You're in the ICU. The stakes couldn't be higher. You've got patients who are immunosuppressed, meaning their immune systems are weak. For them, a simple infection that you or I could fight off, it could be deadly. So you can see why finding these patients and finding them fast is just a huge, huge deal for doctors. So what are we actually talking about with immunosuppression? Well, it's pretty much what it sounds like. The body's immune system is dialed way down. And this can happen for all sorts of reasons. It could be from a disease like HIV or from medications. Think about someone who's just had an organ transplant. They're given powerful drugs specifically to weaken their immune system so their body doesn't attack the new organ. It's a really complex situation. You'd think finding this information in a patient's electronic health record would be easy, right? Well, it's not. For years, it's been a total nightmare. The data is a mess. It's like trying to solve a puzzle where the pieces are scattered all over the place. You've got billing codes over here, medication orders way over there, and maybe the most important clues? They're buried deep inside a doctor's free text notes. The old ways of doing things just couldn't put all those pieces together. And this is where our study gets really interesting. The researchers had a big idea. What if this new kind of AI, these large language models or LLMs, could be the key? Their bet was that these models, which are amazing at understanding text, could actually read those messy doctor's notes and figure things out, almost like a human expert would. All right, now we get to the really good part, the methods. This is the heart of any paper. And these researchers did something really smart. They set up a direct showdown to see which approach was truly the best. It's like a scientific bake-off. Okay, so check out how they set this up. The first thing they did, and this is absolutely critical, was to create what's called a gold standard. You can't just let an AI run wild. You need a perfect answer key to check its work. So they had human experts go through the charts of 827 ICU patients and painstakingly figure out who was immunosuppressed and who wasn't. That became their ground truth. Everything else would be measured against this. So in this bake-off, we have three competitors. In one corner, you've got the old school way, just looking at structured data like billing codes. In another corner, you've got classic natural language processing, or NLP. Think of this as a fancy keyword search. And in the third corner, the new challenger, a large language model, specifically GPT-4o. The big promise here is that it can do more than just find words. It can understand what they actually mean. So what's the big difference? Well, it really comes down to this. The old methods are brittle. They're rigid. They're looking for an exact word or a specific code. If a doctor writes something just a little differently, boof, the system misses it. But LLMs, they're built to be flexible. They're designed to get the meaning, the nuance, the context, to read more like a person would. Okay, so they set up the competition, they ran the test. Who came out on top? Let's look at the data. First up, let's look at the structured data. The key number here is the F1 score. Just think of it as a measure of accuracy, where 1 is a perfect score. And you can see right away, it's all over the map. I mean, it did pretty well for one condition, but then for another, like immunoglobulin deficiency, the score was way down. Super inconsistent. Now, what about the classic NLP, the keyword search? It was even more of a mixed bag. I mean, look at this. It got a perfect score for finding HIV, but then for one of the medications, a big fat 0. It missed it completely. That just goes to show you how fragile those keyword systems can be. But now, look at GPT-4o. The difference is just wow. This visual is called a confusion matrix. All you need to know is that you want to see a strong, bright line going from the top left to the bottom right. That means it's getting things right. And look at GPT-4o's chart. It's a powerhouse. It either did just as well or blew the other methods out of the water on every single thing they tested. It was a total knockout.
Let's just zoom in on one example to make this super clear. Let's take solid organ transplant. The structure data got a score of 0.93. Pretty good. The classic NLP? Way down at 0.74. Not great. But GPT-4o? It hit 0.97. Now you might think, what's the big deal about a few percentage points? Well, in a hospital, that small difference can mean a huge improvement in catching patients who are at risk.
But, and this is so important for us as critical readers, it wasn't perfect. The researchers did a great job digging into its mistakes, and they found that sometimes GPT-4o would almost try to be too smart. For example, it would see a patient was getting a treatment, IVIG, and it would jump to the conclusion that they must have the disease that IVIG treats. It confused the cure with the cause, which is a really subtle but super important kind of mistake.
So, you see, the big takeaway here isn't just to cheer for the winner. We have to be detectives. We have to dig into the nuances and really understand the trade-offs.
And one thing I love about this study is how practical it is. They didn't just test the big, expensive Rolls-Royce of AI models. They also looked at cheaper options and even free open source ones. And what did they find? A classic trade-off. You get what you pay for. GPT-4o was the best, but it costs money. The free version was, well, a lot less accurate. And for a hospital trying to decide what to use, that kind of information is pure gold.
And this is a sign of really good research. The authors were upfront about the study's limits. They said, hey, look, we only tested this on ICU patients, and the AI is only as good as the notes the doctors write in the first place. But they also pointed out a huge strength. They double-checked their work at a totally different hospital and got similar results. That's a big deal. It means this isn't just a one-off fluke. So this all leads to the million-dollar question, right? The performance is amazing, for sure. It's great for looking back at old data for research. But is this thing ready to be used in a real hospital, right now, making suggestions to a doctor about a real patient? Is it ready for prime time?
Okay, let's wrap this up by putting it all together. I want to give you a simple toolkit based on what we've just seen that you can use anytime you're reading about AI in medicine. Here are the 3 big rules. Number 1, always question the methods. Ask yourself, is this a fair fight? Is there a real gold standard? Number 2, look for the nuance. Don't just read the headline result. The most interesting stuff is usually hidden in the mistakes. Where did the AI mess up? And number 3, never, and I mean never, skip the limitations section. That's where the authors tell you what their study can't do, and that's just as important as what it can do.
So this was a fantastic study. It shows us that these LLMs have incredible potential to make sense of all this messy medical data. But it also leaves us with a huge question to think about. The tech is getting really good at reading. But the next, and maybe much harder step, is figuring out how we, as doctors, as patients, as a society, can learn to trust it. And that's a whole different ballgame.